Right, I think I want to go and work for Lynn's. That was fantastic, thank you. Okay, so the next clip from our Christchurch project that you're going to see is about the Canterbury Health System's Shared Care Record View. Now, interestingly, the Canterbury Health System has got a picture a bit like that one that the last speaker just showed, representing their cross-system view of what they're all trying to do. And they have a house at the centre, and they have a hospital right out on the edge of it. And that's their way of showing how they think about having the patient at the centre of the system, and their goal of keeping people in their homes as much as they possibly can to receive health care. So in this story, the earthquake was a catalyst that accelerated their thinking along that strategy. Like the first one you saw, it shows that privacy concerns are not necessarily the barrier that we sometimes think they are. It also features a shared information base that's accessed online by many different agencies. And it's just got that joined up idea that with multiple people, they're actually a single team focused on a single patient. Okay.
So the power of vision is just amazing if people can have a common sense of what direction of travel is going to be, what can be achieved. Canterbury and the Canterbury Health System, over a period of about 4 to 5 years, has been on a journey of involving everyone involved in the delivery of care within Canterbury, creating a shared and common vision and direction of travel. And that has developed a single system that defines the Canterbury Health System. A single system that all parts and parties involved in delivering care feel part of, have been part of the creating of, and live and breathe. That is the direction of travel that our health system is working within. In that, Canterbury has worked to one single budget for the whole of the health system. Everyone working in Canterbury has understood that the biggest wastage we have in health is the patient's time. And we still believe in Canterbury that about 30% of what we do across the Canterbury health system is wastage. And that has driven a lot of clinically led design in terms of putting the patient right back at the centre of what we're doing. Of designing health systems that are about the patient, how we remove their wastage, how we improve their journey for the individual, how do we have clinicians designing and shaping a system that values that patient's time.
I'd like to do what doctors normally do when they run into a situation like this. They describe a scenario for patient care. I'd like to tell you about an 18-year-old young woman who attended in one particular silo for a health care check. She's quite happy, even though this is anonymous, for me to share this information with you, because it well illustrates the need to have trans-sector communication. She attends for a routine check, nothing particular is found wrong. A few days later, when her results come in, a nasty infection is detected. The treatment is very simple. It's only a couple of tablets. So all we have to do is connect with the patient and arrange for a treatment. Unfortunately, like a lot of 18-year-olds, she's very mobile, and none of the connecting information, the demographics within the particular silo that I was working at the time contained any useful information for getting hold of her. It was a simple process to connect across to the other silo through the project to identify where I could get hold of this person. So that simple one-step connection enabled me to get hold of this patient and stop her from living a life with infertility for the rest of her life and chronic pelvic pain. This is no minor matter.
The earthquake has actually also been given an impetus to accelerate the direction of travel that we have been on. It has given the impetus to say that actually things that we were planning to do in the next 4 to 5 years needed to happen today. One of the challenges and the opportunities that we've had is, as a connected single health system, while we have made massive changes to the way that we deliver care, have removed a lot of the wastage that sits in our health system that puts the patient right back at the centre. We had struggled with getting all of our health information connected in a way that regardless of where you were as a patient, your clinician could have access to your record regardless of where you were. So just imagine primary care, district nursing, community pharmacies, hospitals, all of their patient information systems connected in a single portal that would enable your care to be, or your clinician, regardless of where they are in the Canterbury health system, to be able to have that information right in front of them when they're providing your care.